Picture this. A young baby begins having many seizures every day. Her seizures don't stop with treatment. Frequent seizures damage her developing brain. Her development progressively worsens and she will ultimately have a severe intellectual disability. This is a severe epilepsy of infancy. You might not have heard of these conditions, but they affect 1 in 2,000 babies. They're some of the most devastating disorders that we treat as neurologists. Current treatments don't work for most babies, and there's little we can do to stop the inevitable decline. This is an awful problem, but there's a clear opportunity for vastly different outcomes. If we can successfully treat seizures before they've damaged the brain, children do much better, and some even have normal intellect. The prospect of radically different prognosis, if only we had better treatment, is what drew me to research in this area. 2 things are needed for treatment to be most effective. 1, they must be given as early as possible, and 2, they will target the underlying cause of the epilepsy and not just the symptom of seizures. So it's critical then that we diagnose the cause as early as possible, but unfortunately at the moment delayed diagnosis is common. There are over 300 causes of severe epilepsy of infancy. We use many different diagnostic tests, including MRI scans and genetic testing, to diagnose them. To design the most efficient diagnostic pathways, we need to know how common each cause is. No one had looked at this in the current era, so we did, and what we found is really exciting. We found that the most common cause of severe epilepsy of infancy is focal malformations of the brain. 1 in 5 babies has a condition where part of the brain is malformed and the rest of the brain is normal. These pictures show some different types of malformations, some quite easy to appreciate, as on the left, and others less so. Now, this is such an important finding because epilepsy surgery to remove the malformed area can actually cure the epilepsy. So we have an existing effective treatment for at least 1 in 5 babies. This is a much higher number than previously appreciated. If surgery is performed during infancy, we don't just halt the developmental decline, but we can actually salvage lost development. And this is life-changing. But we can only treat these malformations if we know that they're there. A condition called focal cortical dysplasia accounts for most of the malformations. It's diagnosed with an MRI scan, but can be very difficult to see in the immature infant brain. We found them because we looked in really painstaking detail at every single scan these children had had in infancy and later in childhood. But they're often not found, and let me show you why. Here is an MRI scan performed at age 3 months in a child with focal cortical dysplasia in the temporal lobe where the arrow is pointing. Can you see the malformation on this scan? I know I can't. It wasn't until the MRI was repeated at age 3 years that the malformation was seen as the blurry area where the arrow is pointing. Even here, it's not that easy to see. So we need better brain imaging tools to find these malformations during infancy. There are existing technologies that are clearly useful in older children and adults, but we don't know how well they perform in babies or how they might need to be modified. And this is what we're currently working on. We're looking at 3T MRI, which has higher resolution than standard 1.5T MRI. We're looking at PET scans, which measure how the brain cells use glucose. Glucose use is reduced in malformed regions of the brain. Here it shows up as green compared with the red of the surrounding normal tissue in that middle image. We're combining the anatomic information from MRI scans with the functional data from PET scans to accentuate subtle malformations, as in the picture on the right. We can project these images in 3D. The blue malformed area in this picture is centred on one fold of the brain and is more obvious at the depth of the fold than at the surface. This tool helps not only to diagnose a malformation, but also to see exactly where it is, which helps us plan surgery. Here at MCRI and RCH, our patients will immediately benefit from the findings of our research. We have a combined 3T MRI PET scanner, the only one in a paediatric hospital in Australia. We have a world-class epilepsy surgery team that has performed surgery on over 600 children. Babies with focal brain malformations have the most to gain of any child with epilepsy from early successful treatment. We're on our way to ensuring that curative treatment during infancy is their reality. Thank you very much.